Hello, everyone, and welcome to today's session on needlestick injuries in dentistry, prevention, claims, and protection. Today, we're tackling a critical topic that impacts the health of your team, your patients, and your entire practice: preventing needlestick injuries. At professional insurance programs, we see firsthand how these incidents can create not just health risks, but also financial and legal challenges. The good news is that with a few simple practices, you can greatly reduce the risk to your practice. Let's dive in. Here's a quick look at what we'll cover today: why needlesticks matter so much, how these injuries typically happen, real-world claims and financial impacts, prevention strategies that truly work, OSHA, CDC, and insurance requirements, what to do if an exposure occurs, and finally, key takeaways to protect both your team and your practice. Needlesticks are the #1 cause of bloodborne exposure in dental settings. A single incident can lead to serious health risks, workers' comp claims, and OSHA citations, and higher insurance premiums for your practice. The good news is, most needlestick injuries are completely preventable with the right protocols. Needlestick injuries often happen during routine tasks. Common causes include two-handed recapping instead of using a safer one-handed method, losing focus during post-procedure cleanup, improper disposal of sharps, and passing uncapped needles from hand to hand. All of these are preventable with awareness and better habits. When injuries occur, the associated costs are real. You could face medical expenses for post-exposure testing and treatment, OSHA fines for lack of compliance, increased insurance premiums at renewal, or even a non-renewal if there's a frequent problem with workers' compensation claims. It's not just about health. It's about protecting your entire practice. Prevention starts with simple, repeatable habits with an emphasis on workplace safety. Always recap needles using the one-handed scoop method or a recapping device. Immediately dispose of sharps. Never set them down or carry them across rooms. Use safety equipment like retractable needles when available. Stay focused when handling sharps, no distractions. And make training a regular event, not just a once-a-year checkmark. Here are a few best practices to keep in mind. Always use the one-handed scoop method if you need to recap. Preferably, use recapping devices or holders. Never pass uncapped needles hand to hand. Immediately place used needles into designated sharps containers. For sharps disposal, use point-of-use containers that are puncture-resistant, covered, and easily accessible. Replace containers before they get full. Ensure all staff members are trained on the correct disposal procedures. Don't forget, compliance is a requirement, not a suggestion. OSHA requires every practice to have a written sharps injury prevention plan. The CDC sets standards for universal precautions and post-exposure responses. Your insurance also requires prompt and proper reporting when an exposure happens. If a needlestick occurs, act immediately. Stop working and safely discard the sharp. Wash the site thoroughly with soap and water, no harsh chemicals or scrubbing. Document the incident clearly and notify your supervisor. Seek medical care, ideally within 2 hours. Contact your workers' compensation insurance carrier to report the incident. To wrap up, prevention should be part of your daily routine, not just occasional reminders. Strong safety protocols protect both health and finances. Quick, proper action after an incident minimizes complications and cost. In closing, remember that needlestick prevention isn't just about compliance, it's about caring for your team and protecting the practice you've worked so hard to build. If you have any questions or would like help reviewing your protocols or insurance coverage, please reach out to us professional insurance programs. You can call us at 800-637-4676, email us at info@profinsprog.com, or visit insuranceformmembers.com. Thank you for your time and for everything you do to protect your patients, your team, and your practice.